start off some of the questions that have been posed during the webinar and were submitted before when people registered. The question was, we are still using React to Red in our trust. However, one of my colleagues attended Wounds UK and was informed React to Red is being discontinued. Can you take that one for me?
Yes, definitely. React to Red belongs to the YHSN in Nottingham, so we are not recommending its blanket use. But one of the things that I would like to say is that we need to be careful and considerate with our use of language, because in the same way that if I'm talking to a patient, I might use the phrase bed sore, and I think, Luxmi, you said you talk to the patient about a bed sore. If you are talking to a patient with white skin, there is nothing wrong with saying to them, if your skin is red, let us know. But what we need to do is be aware of our patients and their needs. We need to be considerate in our use of language. And that's why we're saying as a blanket thing, React to Red is not appropriate, because it does not consider diversity. If, however, you are talking to a patient who does have redness in their skin, it is very appropriate to tell them that if they see redness, they must see that as a flag and alert you to a change in their skin colour.
Are there any NHS trusts which have adopted the use of a skin tone tool? And if so, is there any data available to evidence its efficacy?
I'm not aware of any NHS trusts that have adopted a tool. However, the tools are moving towards language around discoloration rather than focusing on the historic redness. So there is acknowledgement within the tissue viability world and wound care specialists that there needs to be a movement. So there is work ongoing. Luxmi, you might be able to add if there's anything from your practice area.
Yeah, and I can proudly say Central and Northwest London has implemented the colour toolbar already. Every single staff's been given a card, and we're using it in practice, following the massive implementation of best practice statement in November that we had. I am now reaching out to every services to do a session on how to use it and include darker skin tone in all our assessment. And I'm sure I have spoken to my colleagues, tissue viability, who are doing similar things in other areas.
Do you know of any products specifically for dark skin tones that would give a better cosmetic outcome? This question's for Luxmi.
If we're talking of dressings, then I would suggest that the rationale to have a dressing is nothing related to skin tone. So it has to have the rationale to have the dressings. I know some companies are working towards it, but not really cosmetically. Maybe Jacqui can help.
Yeah, I think one of the things we addressed in the document was the colour of dressings, and dressings tend to be pink. And my view on that is the dressings aren't the colour of my skin. They're not the colour of anybody's skin. Yeah. Dressings tend to be white or pink or light colours so that you can see strike through, so that you can see blood. And that's an important clinical indicator that you can see that a wound is leaking or that a patient is bleeding. So what we wouldn't want is to start having different tones of dressings for patients that might mask those important clinical indicators. So I want to make it very clear that as far as I'm concerned, the colour of a dressing is not about matching somebody's skin colour. It is about having a clinical assessment available through the product.
I have a question for Neesha. In your presentation, you were talking about nurse education. What can nurse educators do to make education around dark skin tone more meaningful and less tokenistic?
I think it's about having the conversation. So nurse educators actually talking about it, because that was one of the factors that came from the research, was that nurse educators didn't feel comfortable even talking about it, let alone including it in the teaching material. So having a safe space to talk about skin tone diversity and allowing that conversation to flow. So not restricting the questions. So asking, what have students seen in practice, and then building on that conversation yourselves as nurse educators to question, okay, so you've seen redness, and so what else have you seen? Is that the way it presents on someone with darker skin? So facilitating that questioning, because the students have the question, they just need the courage to ask the question. So I hope that answers the question.
Thank you.
Could I comment on that, Debbie, as well? Because just
course,
from
yeah.
my perspective, I've been talking to lots of colleagues about this, and I was talking to a podiatry colleague recently. And one of the things when we were putting the document together is we talked to some colleagues from lower limb services, from podiatry services, and lymphedema services, and they said this had not been raised at all within their sphere. But talking to Krishna about in podiatry, is this a problem? Because obviously you have the problems in diabetic foot ulcer where you don't get a good inflammatory response anyway, so the symptoms of inflammation are very poor. And I asked her about on her skin, because she has a dark skin tone, what does she see redness as? And it was really interesting that she said that actually she had no idea, because redness didn't happen on her skin. She'd never thought to look for it because it wasn't, the picture I use is because when I've had my legs crossed, I have a really hot red mark. I see it, it's flagged me. If you don't see that on your skin, it wouldn't lead you to think, oh, I've got something on my skin that I need to feel. So I feel it because it's red. And I think we need to remember that if it is not your normal, you might not know what you are looking for because you haven't had that really visual indicator. So to really pick up on what Neesha's saying, we need to encourage students to share what their experience is, because if you're stood in the classroom and you haven't had that experience, you need to engage them with you and get them to share and to explore for themselves and to help develop your knowledge and skills as well.
To all of our speakers, do you feel that there is adequate focus on assessing dark skin tones within the current European, national and Pan-Pacific guidelines?
I think it's improving. I think certainly 2019 guidelines, international guidelines, we saw it discussed far more than it was in the 2014. And if you go online and look, so for example, at the American NPIAP guidance, there is a whole section on their website that guides you how to look at different skin tones. But it is very focused on pressure ulcers. I'm not aware in those other nations of this broader focus that we're trying to say that this is about assessing skin. It's not about assessing pressure ulcers, it's about assessing patients' skin.
Thank you. A lot of comments and questions around and interest around how training sessions can be taken from today's session, which is great to see. Questions on where can images of wounds with dark skin tones be, where can people get those images from? Obviously, Luxmi, you've used your own and gained that permission from your patient.
Yeah, so obviously we do have some, but obviously cannot be shared outside my training session. But I'm sure, because when I did look at Google previously, there was some pictures and it is improving. There has NPIAP, sorry Jacqui, correct me, and they have done a whole brochure of different categories of pressure damage from Cat 1 to deep tissue injury, so that can be downloaded freely as well. And there are pictures there to guide clinicians on what to look for. And there are some really good pictures on the international guidelines as well to use.
And you can request permission to use the images that are in the document from Wounds UK. So you just need to email them, and as long as you email them and request permission, you can use those. If they are specific to pressure ulcers within the national document, we did the categorisation document as part of NHS Improvement some years ago. There are different skin colour tones in there. They are free to download and free to use also.
It's talking about, are there further areas of research that could be looked into to advance practice of dark skin tone assessment in the UK?
There's so much more. Mine is the tip of the iceberg. Mine was just the first piece of work that was done. So anything of the topics that we spoke about, jaundice, even domestic violence, thinking about how does that present on someone who's come to custody saying, there's been domestic violence, that actually are there perpetuators that inflicting the violence? Is there lack of evidence? So there's so much more research that needs to be done and just hasn't even been thought of before, because we're just so used to delivering on treating everyone the same. and treating everyone with an assumption of whiteness that we can see, but actually there's health inequities much broader than healthcare, that interlink with healthcare, but much broader.
For everybody, are there sources of learning for clinicians who feel that they would like more education either in terminology or clinical skills required for better assessment?
The best practice statement is the place
Best practice
to go.
statement, free to download. It covers everything we've talked about today, and it's got a really good comprehensive list of references.